Hello there, I'm Dr. Suleiman here, chronic pain GP, and today's video is about examination and investigations in chronic pain. So, by the time I've seen patients in the clinic, often they've been investigated and examined many times over the years. However, as with all clinical interactions, it's imperative that the patient is listened to in the form of a history and also examined. So the examination can be targeted and quite specific, for example in conditions such as osteoarthritis of the knee, gout and chronic back pain. It can also be generalized in chronic pain conditions such as fibromyalgia, lupus, rheumatoid arthritis, polymyalgia rheumatica and other autoimmune conditions. I won't be showing off my examination skills today for all the specific conditions because that can be quite a lengthy process, and I'm aiming for these videos to be less than 5 minutes. However, I would advise clinicians to be quite respectful, gentle and clear in their examination of those patients who are in chronic pain. I fairly often see in chronic pain patients having a painful response to a non-painful stimulus, such as examination or gentle touch, and this is called allodynia. This can happen, for example, when examining the lower back, and is, as mentioned previously in previous videos, this is often due to the process of central sensitization. With respect to back pain, there are a couple of specific examinations that I do, particularly looking for one of the emergencies in back pain, such as coronary equina syndrome. With coronary equina syndrome, often patients describe a history of sexual dysfunction, urinary problems, bowel disturbance and numbness in the perineum area. This is clearly a neurosurgical emergency, and I often signpost them to relevant services. So when it comes to investigations, these can be split into blood tests and scans essentially. When it comes to blood tests, the most common ones I do in chronic pain patients are a full blood count, which can check for problems such as anemia, something we call urea and electrolytes, we can check for kidney disease and calcium problems, liver function tests, where liver disease can cause systemic pain in patients. Autoantibodies are checking for autoimmune conditions such as systemic lupus erythematosus or Sjogren's syndrome. I then can also check the inflammatory markers such as ESR and CRP. Now, the ESR is an inflammatory marker for chronic conditions, and the CRP is an inflammatory marker for more acute problems. The two specific markers I check for with respect to rheumatoid factor and anti-CCP, and these are commonly elevated in conditions such as rheumatoid arthritis. I can also check for thyroid problems and conditions such as diabetes. A urine dipstick test can be helpful to find conditions such as diabetes and kidney problems. Now, the decision to investigate with scans or x-rays should be made with the patient, and the clinician should always ask themselves for what purpose are they investigating with scans, and what is the outcome likely to be, and will it change my management. So the common scans we do in primary care are the following. It can be x-rays, which looks for bony pathology, an ultrasound scan which can check the small joints, particularly looking for synovial inflammation and tears in muscles or ligaments. A CT scan can on occasion check for problems with back pain, and that's only really if patients are unable to tolerate an MRI scan due to claustrophobia issues. The MRI scan is used for soft tissue, as well as looking at problems with the spinal cord or the brain, and it can also be used for checking for hip problems. And the last test is a nerve conduction disorder, which can check for problems with nerves such as polyneuropathy and foot drop. Now, when I see patients in clinic, sometimes patients have been in pain for many years, and therefore occasionally I have to repeat some of the investigations. In my experience, patients can often present at different stages along the pathway of their chronic illness, and therefore sometimes it can take some time before we come to a diagnosis. And the diagnosis will be the title of my next video, and hopefully I can provide some clarity on some of the complex diagnoses that we give in chronic pain. I hope that's been useful, and the last thing to say is please subscribe and like the page, leave any comments below and I'll try my best to get back to you as soon as possible. Thank you for watching.